So thank you for inviting me today and inviting the American Lung Association to be able to be part of this important conference. The mission of the American Lung Association is really to promote health of lungs and prevent lung disease. And the tools we use to promote this mission are education, advocacy, and research. We have several yearly signature reports that are key to educating and raising awareness of issues and providing a platform for effective advocacy related to lung health. They include our state of tobacco control, state of lung cancer, and our focus today, of course, our oldest signature report, the state of the air. We believe these reports provide policymakers, researchers, healthcare practitioners, and really anyone committed to preventing lung disease and promoting lung health, a foundation for identifying where their state can best focus its resources. Now, the best way to reach people and to motivate people and possibly change their behavior is to tell stories and communicate the human impact so that issues become personal.
Congress can't ignore the facts. More air pollution means more childhood asthma attacks. Log on to lungusa.org and tell Washington, don't weaken the Clean Air Act.
So this was a PSA that we made about a decade ago to encourage policymakers to strengthen pollution protections, and its effectiveness really rests in its ability to communicate the health impact of pollution in a powerful way that people tend not to ignore when you put a baby into the picture. Now, we know that carbon dioxide is the most recognizable culprit of greenhouse gases and is released through natural occurrences like volcanic activity, but also human activities, including deforestation we've heard about, burning fossil fuels, all of those. Now, carbon dioxide is typically painted as the bad boy of greenhouse gases, but we know methane is roughly 30 times more potent as trapping the heat, and is produced through landfill decomposition, agriculture, livestock, and much more. So the impacts from climate change include extreme weather and climate-related events, air quality changes, the transmission of diseases through insects and pests, disruption of food and water supplies, and increasingly threaten the health and well-being of the American people, particularly populations that are already vulnerable. A number of infectious diseases well known to be climate sensitive include malaria, dengue fever, West Nile virus, and we've heard Lyme disease as well. And we know climate change results in higher temperatures and more extreme weather events. And also due to climate change, we'll talk much more about it, are ozone and particle matter pollution and how they impact on mortality across different studies, across different parts of the country. Climate change has been a key factor to increasing the risk and the extent of wildfires in the Western United States. Research shows that changes in climate that create warmer, drier conditions, such as droughts and longer fire seasons, are boosting these increases in wildfire risk. So how do we know that climate change is degrading? Well, we released the 21st annual State of the Air report last spring, and we started this report about 20 years ago to translate air pollution data into everyday language and share local information on the quality of the air that the public breathes. We focus on 2 of the 6 criteria pollutants, ozone and particle matter. These are 2 of the most common and dangerous air pollutants. And I will explain later, last year's report, and certainly the report we're going to release this April, will not reflect any of the severe issues we have seen during 2020 that include California's worst wildfire season and the record number of tropical storms in the Atlantic. But even without this recent data, we're starting to see some disturbing trends. As you can see on this slide, the yearly State of the Air report plays a significant role in raising awareness. Each year, it is anticipated by the media and heavily reported upon, with media impressions ranging in the 4 to 5 billion number each year. We now have compiled 21 years of trusted reports, and it's evolved into a go-to resource on air quality for the public and policymakers. The report gives A through F grades to counties based on ozone days and both daily and annual particle matter measures. And it ranks the cleanest and most polluted metro areas across the country. More details on each of these events can be found at lung.org/SOTA or State of the Air. We'll talk more about these websites as we go through the discussion. Now, where do we get the data and how do we compile it? Well, air quality data from EPA monitors is collected across each state, often at a county level. And the data for this year's report was collected for the years 2016 through 2018 and are the latest available that are quality assured. We use this data to calculate the grades and rankings, and we also check in with air agencies across the country to verify the data. In order to get this level of quality assurance, our reports need to lag a few years behind the data that is accumulating. As seen on this slide, the 2020 report showed that 150 million Americans, representing 46% of the nation, lived in counties with F grades in air quality. This is up almost 9 million more than the 2019 report and 16 million more than the 2018 report. Obviously a disturbing trend. So let's start by looking at ozone. In this year's report, 14 of the 25 cities with the worst ozone pollution had more unhealthy days. Now, even just a few unhealthy ozone days a year pose health concerns, as an increased number of health risks are being linked to exposure to ozone. Ozone pollution is associated with higher incidence of pneumonia, cardiovascular disease, asthma attacks, with studies showing that hospital admissions and visits to the emergency room for asthma are increased due to elevated ozone levels. So what's the reason we're seeing this trend towards greater levels of ozone pollution? Warmer temperatures can increase the risk that ozone will form and also take longer for it to dissipate. The 3 years covered in this report, 2016 through 2018, were among the 5 warmest years recorded globally. Ozone levels are typically elevated in urban areas, partly due to the urban heat island effect, and cities often have more vehicles, manufacturing, power plants, and other sources of emission that are precursors to the ozone. And ozone is not just an issue in the summer. The ozone season is now monitored year-round in 8 states, and the EPA lists 192 sites in counties throughout the country that currently monitor year-long ozone seasons because of the change in temperatures. Let's take a look at particle pollution. Looking at the cities that recorded the worst average number of days when particle levels were unhealthy, 22 of the 25 on that list suffered more days on average in 2016 through 18 than in last year's report. 9 had the most unhealthy days ever recorded since we began tracking performance for particle matter in the early 2000s. The health effects of inhalable particle matter are well documented and include respiratory and cardiovascular morbidity, increases in hospital admissions, and mortality from cardiovascular disease, respiratory disease, and lung cancer. And we also know that climate change is bringing more conditions where these spikes in particle pollution occur. Droughts leading to wildfires and weather inversions that trap the pollutants closer to the ground. As compared with urban background particulate matter, which results mainly from the combustion of fossil fuels, wildfire particulate matter tends to have a smaller particle size and to contain more oxidative components and more pro-inflammatory components, features that potentially lead to stronger toxic effects on the lungs and the body. Now, adding to data from the already bad year of 2017, this report includes the more devastating fire season of 2018, where daily particle levels spiked in 9 cities, all of them in the West, to the worst unhealthy days ever recorded. Our 2020 State of the Air report does not look at that impact of the devastating ongoing wildfires in the West this year. And since I noted there's a several-year lag in this data being accumulated, much of the last year or two may not reflect in our State of the Air report coming out this April. So what is the state of the air where you live? You can learn about the air quality in your city or county by going to the website lung.org/SOTA or stateoftheair.org. You enter your zip code or state, and you'll quickly get the 3 grades that your area gets for ozone, daily, and annual particle pollution. And we know air pollution is now the biggest environmental risk for early death. It's responsible for as many as 5 million premature deaths each year from heart attacks, strokes, diabetes, respiratory diseases, and that's more deaths than from AIDS, TB, or malaria combined. With the risks from airborne pollution affecting all of us, it's important to realize there are groups who are even at higher risk. Children and babies whose lungs are still developing, as well as pregnant women, are at greater risk. There was a report from the State of Global Air from the Health Effects Institute in 2019 that reported that nearly 500,000 infants died in the first month after birth due to exposure to ambient and household air pollution. We know that the extremes in ages and those with chronic lung conditions such as asthma and COPD, as well as those with cardiovascular diseases, are at higher risk. And in our report, you can see in each category the millions of people that live in counties where F grades are given. We also know that poverty plays a role. Our report showed that more than 18.7 million people with incomes meeting the federal poverty definition live in counties that received an F for at least one pollutant, and more than 3 million people in poverty lived in counties failing all three of the tests. State of the Air 2020 also found that people of color are 1.5 times more likely than white people to live in a county that has a failing grade for air pollution, and 3.7 times more likely than white people to live in a community with 3 failing grades. Practices like redlining have long-lasting impacts on communities of color and that they're still facing today. Efforts to clean up the air must prioritize areas that have historically been overlooked. Now, no presentation this year could go without mentioning COVID-19 and its potential effects, and we've heard some about this already. Assessing whether long-term exposure to air pollution increases the severity of COVID-19 health outcomes, including death, is an important public health objective. Limitations in COVID-19 data availability and quality remain obstacles to conducting some of the conclusive studies on this topic. However, a number of studies have already been reported during the last year, and you've heard some of them. The Harvard study finding the higher historical exposure of PMs was linked with a higher level of COVID-19 deaths at the county level, even after accounting for other confounders. A study published this past October in Cardiovascular Research estimated that 15% of the deaths worldwide were related to COVID-19, attributed to long-term exposure to air pollution. In Europe, the proportion was 19%. In North America, it was 17%. And a study from the SUNY School of Forestry and ProPublica found that COVID-19 mortality was higher in areas with more exposure to hazardous air pollutants, as well as areas with higher PM and ozone levels. Another study in the Journal of Environmental Justice looked at the relationship between particle matter 2.5 and other air pollutant levels, race, COVID-19 death rates in Louisiana. It found that a higher burden of air pollution was associated with larger percentages of Black residents and increased unemployment, and higher COVID-19 death rates were associated with larger percentages of Black residents, even when accounting for comorbidities such as diabetes, obesity, age, poverty, and smoking. These studies suggest the United States will increasingly face complex, challenging scenarios, given the confluence of our two most pressing global health threats right now, the rapid emergence of the COVID-19 pandemic and the insidiously evolving climate crisis. Both these crises disproportionately harm the health of vulnerable and economically disadvantaged people, including those affected by structural racism. However, there is some good news. Progress continues, thanks to the Clean Air Act mainly. This year's report celebrates the landmark 50-year-old bipartisan law that has helped us clean up sources of air pollution. And it's also the 30th anniversary of the bipartisan 1990 Clean Air Act amendments. The signing of the 1990 amendments marked a milestone in Clean Air Act history. These amendments set the stage for protecting the ozone level, reducing acid rain and toxic pollutants, and improving air quality and visibility. But the State of the Air report also calls attention to several threats to air quality, even threats to the law itself, and they both need to be protected. Now, when thinking about this, it's important to keep in mind that despite polluters' claims of being the victims of the Clean Air Act, the reality for the country is different. This graph from the EPA shows that we have clean air and a good economy. Here's how to read the graph. The graph tracks since 1970 when the Clean Air Act was passed. The purple line you'll see is our emissions have decreased, meaning better health. In fact, we've cut emissions of the 6 common pollutants regulated under the Clean Air Act by 70%. Meanwhile, you see the blue lines that our population and energy consumption have stayed the same. In the light green, you'll see that we're even traveling more. The dark green line, you'll see our GDP has dramatically increased at the same time the pollution levels have fallen. This graph tells the story of improving efficiency and emission control. These diverging curves tend to refute the orthodox green claim that only degrowth can curb pollution, and the orthodox right-wing claim that environmental protection must sabotage economic growth and people's standard of living. So what can you do to help support clean air and our nation's health? In honor of the 50th anniversary of the Clean Air Act, the American Lung Association helped support the creation of Unbreathable, the Fight for Healthy Air, a film by American University, and I'm going to show you the trailer.
Before the Clean Air Act was in place, we literally had cities that you could be in and you could look up and not see the sun.
You saw the cars smelling terrible, and so the pollution was a visceral experience.
We know that long-term, low-level exposure to polluted air is unhealthy.
1969 was the year of the landing on the moon. You had sort of a collective attitude.
Surely we can move confidently now to achieve a better, more peaceful life for our fellow humans.
Action to clean things up may have begun in Washington on this Earth Day.
There are few pieces of legislation that affect everything you do all day, like breathe.
Whenever there were efforts to change, roll back, stop advances, environmental protection, it has been the health issue that has rallied people.
If it's about you, your family, your kids, you will demand that the federal government step up.
It's a human right to breathe clean air, and that right is being violated.
We have implored DuPont to at least reach what EPA says is a safe level. They have refused to do it.
Neighbors near the Clairton Coke Works showing just how frustrated they are.
Who is tracking our health and what system is in place?
There's a problem in Clairton, but there's a problem all around this area because this pollution travels.
It takes government at the federal and the state level. It takes business and industry throughout the country, and it takes citizens pushing in the right direction.
So to help get the word out, we're making this film available to the public through our Healthy Air Activist Toolkit. This toolkit is available to everyone and is designed so the message of health is integrated into conversations around climate change. To this end, the toolkit will provide social media GIFs and memes, as well as the ability to screen films with discussion guides. 3 films are available through the Activist Toolkit, including the full Unbreathable, the trailer of which you just saw. So visit lung.org/air to take the pledge to stand up for clean air, and we'll be in touch with some simple steps on how you can make a difference. We'll also keep you informed on critical opportunities to take action, such as key moments when you have to call leaders about transitioning to electric vehicles or strengthening the Clean Air Act. So for the health professionals in the audience, I would like to close in highlighting the importance of your voices. And I echo what Dr. Bernstein said earlier. Your voices in the fight for clean air and healthy climates is very important. The American Lung Association invites you to join its community of health professionals for clean air and climate action. You can go to the website shown, lung.org, Climate Changes Health, and sign up to receive monthly newsletters which provide easy opportunities to take action. And on this slide, you see some of the examples of our members of the Professionals for Clean Air Act and Climate Action community engaging in advocacy events, such as testifying at the EPA hearings, meeting with decision makers, and more. We hope that you will join us. So please mark your calendars and watch for our next State of the Air report that is slated to come out on April 21st. And thank you for your attention.